Thank you so much. The power of community-based participatory research is really clear. And I'd like to ask a question, but first, I really I was intrigued by the top three things being community, youth, and police, because I think of community as building connection and building beauty, and police is building safety, and with youth, building a future. And it was really, it was interesting for me to see those top three things to come together. We wanted to really have an opportunity for just maybe 10 minutes to talk with our two colleagues here presenting, but also loop in as we can the brain trust that's over at the table. So I'm going to ask broadly, collaboration is challenging. And so could you maybe speak to the challenges of collaboration between community and academia? And then the other side of that is how did you overcome some of these barriers? Because I assume there were some.
That is an essential question, and one that we have encountered time and time again in this work. And while I could offer an answer, I suspect that the answer that we would really like to hear would come from Anne Green. So Anne, would you please speak?
As you know by now, we're from New Haven, and Yale University is as old as God itself and has tremendous power. So there has been a relationship between town and gown that has changed over the years, but much of what people bring into the experience of working together is determined by that. So what happens? You have researchers who have their agenda, which not in a negative sense, but they're doing research, they're on a timeline, they have training. You have community members who have another agenda, which is that they want to affect change in their communities. You have researchers whose work is supported, they're paid. You have community members who are volunteers and not paid. And so part of the conflict is the level of commitment that people can bring to this work. Another part of it is the kind of inherent power differential that comes with city folks working with university people. I think in this particular instance, we were all fortunate. We're not putting on for you. This really is a team. And there's a tremendous amount of mutual respect. There has been a tremendous amount of growth and exchange. And I think what binds us all together and keeps us going is that we believe so deeply in the work that we're doing, and we've come to realize that we can learn from each other. I would say as, and you know I wear two hats, but I would say as a community person, I have my estimation, and I think I could speak for others at the table, my estimation of the value of research has increased. And on the other side of the table, I feel that my research partners, my academic partners, their work has been enriched by the work that we've done together. So in this instance, we were very successful. Perhaps this is a little bit unique, but it's worked very well.
Thanks, Anne. The other thing I was going to state in thinking about the work that we have been doing in this project, I think it's slower than other projects I've done. Not all the work that I do is using community-based participatory research methods. For us to get to this place, it's taken 4 years, and we're just at the place of now in the intervention. And so one thing that I think is important is we think about moving forward and even given, as has been mentioned here a couple of times, the NIH commitment that is cross-institute, really exploring the epidemiology, the impacts, interventions towards gun violence, is the financial investments towards community-based participatory research, towards really investing in these partnerships. We have been fortunate at Yale University through funding from the Robert Wood Johnson Foundation, the way that Dr. Riley and Dr. Roy have come to us is through the Clinical Scholars Program. So this is a program that teaches young scholars, physician leaders, the process of community-based participatory research. It's with that investment that I think we've been able to do this work. There are, I think, currently funding opportunities that are funded by the National Institutes of Health. They've mentioned one today, which is Youth Haven. That in and of itself is a CBPR process that's funded by the National Institutes of NICHD. And so one thing that I think is important is that these funding streams that are available really to study, to build the science of preventing and responding to gun violence, that they acknowledge the fundamental benefits of this sort of approach, of bringing community and academic partners together to really think about the science that we're doing, the interventions that we design, and ultimately the dissemination into the communities that we care most about.
Thank you. I have a couple questions, and I'm thinking since there may be a collective response, if Shelley, you could ask your question, and then Stephen, if you could ask your question, and then we'll see how it rolls out with response.
Thank you. You talked a lot about the process, and the coming together of the process. In the beginning, did anyone paint a picture of what the neighborhood should look like if you're infinitely successful, or did you take the results as they came?
And thank you. And I had more of a, this is great to present this as the way you've done it. The sampling, you didn't say the 35% that didn't respond. Are you concerned about not getting that proper input from the beginning, from the 35 who said, I don't want to respond, and the 35 that weren't home, didn't know what that means, times 3, and the 14% that didn't respond? Are you concerned about a sampling error that might impact the development of your project?
With regards to the second question, yes, that is something that we are concerned about. To give you a bit of clarity around that 35% in sampling, we used a random walk methodology where we selected every other address, regardless of what the state of that home was. And we do not yet know how many of those homes were vacated, although we suspect that many of them were. In terms of other techniques that we use to try to access as many individuals as possible, we did a survey at many different times throughout the week. We also tried to be very present in the neighborhood in order to build trust such that individuals would feel comfortable opening their doors and engaging with us. And we did find that the longer we were in the community, the more doors would open. And so we needed to be patient and understand that. We also did things around flyering ahead of time so that individuals knew that we were coming, and then flyering subsequently to know what it is that we're doing with the information that we were there to collect. And we expect that this will be a continued sort of ongoing iterative process in which we continue to build the relationships within these neighborhoods, and then we continue to access more of the voices that we have not yet heard, because they are all valuable to what this work is.
But the 14%, kind of the refusal, those turndowns are actually quite low. So there have been other community surveys in the community in New Haven exactly and nationally that are addressing these, attending to these sorts of issues, and they are on the order of 40% as high, and none have come as low as 14%. So I think while it's true we're not certain, we don't know the 35%, the 3 times knocked on the door, no one's there. So we don't have any sense of kind of whether or not that systematically biases our study. Certainly the 14% is a help, is a boon.
Mm-hmm. The second question. Yeah, and then the question regarding process, really. Brita, can you speak to that?
So if I understand the question correctly, it was at the beginning, did anyone paint a picture of what success would look like? Mm-hmm. Sure. To be honest, some of the work started before Carley and I even arrived at Yale. So the very beginning, I'll have to ask someone else to respond to that. However, since we have been working with the group, I think we sort of have we've developed a collective vision of a community, I think, that that really works together, trusts each other, is willing to really help each other out and be engaged with other local leadership in the area. And also we've started bridging neighborhoods together. So the two neighborhoods that we've talked about, New Hallville and West River, for a long time, the neighborhoods in New Haven were very separated, and people felt allegiance maybe to a certain neighborhood and negative attitudes towards other neighbors. But through this work, we've been able to bring two of these neighborhoods that were very separated, now starting to bring them together and learn from each other. And I think that's part of the vision that has sort of, we've put together moving forward, or really started to dream bigger than just each neighborhood on its own. I want to comment about the vision when we first started.
Hi. I was at the table in the very beginning, and I can tell you the picture that I had as a resident of New Hallville for my entire life, basically. At the time that it was evolving, New Haven in 2011 had a high volume of youth being killed. And so at that time, I had a son who was of that age. And so for me, I would say the picture was to have a blank slate to start with and leave off the high gun violence that the neighborhood was dealing with at the time. And then from that, a connectivity amongst the neighbors and the residents. So I think that would be a picture that I would have drawn. And that's before the results that we have now. And so now with the results, I see my picture coming together.
Thank you very much. I'm going to take a risk, and since we're changing out our day a little bit, question from Michelle Burwell, and I'm going to take these two questions, and then we're going to come, we're going to come back to our panel. So I'm going to ask the other two folks to bring that question to when we convene our larger panel.
Yes, thanks. Terrific. I guess my question is that we know that a lot of the violence is youth violence, and yet youth were notably absent from both the survey and it seems the response. And now we know that youth voice is so important in terms of identifying risk programs and their perceptions of what they need. Can you speak to that a little bit? Thank you.
Mine's quite different, really a more technical question about, I want to understand the evaluation design a little better.
First, with regards to the youth, they are essential, and there's an ongoing effort within New Haven to bring them into this work. The community resilience team is taking that exceedingly seriously and reaching out in many different ways.
So that is to say that there is kind of a simultaneous process that really honors the voice of youth, that doesn't kind of overshadow with the input of adults, really engaging the youth voice in New Haven. So we don't present those results. Many folks here are actively in communication with the folks that are leading that, and that too is an academic community partnership. But thank you, because that's absolutely right, and nowhere more so than in New Haven. So regarding your specific questions with the evaluation, so this is a pilot study, really kind of trying to see first if we could do it, to see if we can even get out there, survey, train folks to be able to deliver the survey, have a low kind of refusal rate. But our specific design is a difference in difference. So we are not collecting information on an individual or household level. When we go back and survey in the summer, we will be comparing the neighborhood rates of these key variables to the neighborhood rates of the variables post-intervention. There are all sorts of flaws with that. There's no comparator group. We
There's
know that.
no neighborhood that's not getting, you're studying that's not getting the intervention?
In the pilot study,
Okay.
we are planning to do that exact. So our kind of next iteration will be bringing in, again, and scaling up in the ways that are meaningful and are feasible in New Haven. We'll bring in a third neighborhood out of the 6, and the 3 and 3 over time will then be the better study, where the comparison group is that of other neighborhoods that aren't getting the intervention. The other variables that we're going to be looking at are morbidity and mortality of gun violence. We're not powered necessarily to look at that, but we will be able to compare the pre and post. And in fact, we have data that came in this week looking at emergency department morbidity as well as, mortality, looking at ambulance runs for gun-related calls. And this is in large part due to a partnership with the Yale New Haven Hospital and our
Yeah.
collaborator,
Of course, without a comparison group, there are all sorts of threats to the validity of any
Absolutely.
pre-post comparison. Is Steve Raudenbush a consultant to the project?
Pardon?
Is Steve Raudenbush a consultant?
No.
I would suggest that you might get him as a consultant.
Thank you.
I'm going to succumb to peer pressure and take the last 2 questions. So if you could please ask your question, and then Andres, ask your question, and then we'll come back. And the other panelists, if you could work your way up this direction, please.
So I just wondered, the work that you're doing around policing and improving policing, and I was interested in your slide about the community's perspective. I just wondered, are you working with Tracy Mears and Tom Tyler at Yale Law School?
The short answer is yes, not actively on this project, but again, there are many individuals at Yale University that are longtime experts in this work. We are, I think, more immediately, we're in partnership with the police department. So the actual kind of actors, individuals, people that are kind of running the community policing efforts with Chief Esserman in Connecticut. And those partnerships are strong. They are complicated, but they are strong, and that we're certainly at the table with them, and they're at the table with us. Thank you for the question.
Thank you for a very interesting presentation. I was struck by the similarities between what the community, youth, and police raise as important issues, with similar issues that are raised in countries like Brazil or Colombia or Honduras. It's really interesting to see that. I wanted to get your thoughts. I know this is a pilot study, and you've talked a little bit about the external funding that you might have, but how are you envisioning sustainability of activities like this, 5 years, 10 years down the line? How can you talk a little bit about that, if you've thought about that strategy?
Sustainability is something that we're actively talking about, and in a number of different ways. First, for the community resilience teams themselves, and helping build an infrastructure as well as a funding mechanism by which that they can sustain themselves, even independent of the research work that we're doing. We're also embedding a relationship really with the community resilience teams in the city as well. There is recent funding from a burn grant from the Department of Justice that is coming into the city of New Haven, with the community resilience team as one of the actors or participants responsible for us being able to gain those funds, and will also be an active recipient of those funds. There's also other work that we, as we are continuing to leverage this data from a pilot study into a study that is really sort of more scaled and is in many ways broader and deeper, drawing funding also from NIH as well as other bodies that fund this sort of work in violence and firearm violence as well. So we're using a sort of a diverse portfolio in many different ways to bring funding in to support this necessary work in New Haven.
I'm just going to add one thing to that too, is just even the local trauma centers for the injury prevention funds that are there to kick in, the toolkits and those kind of things. So there's a lot of ways to get the funding, not just for, the big project itself, but even little components of it. And the second thing, to the Tracy Mears question there, she's actively involved in other projects we have that we're actually looking at, like a social autopsy of the actual violent crimes themselves, with Andy Papacristo in the New Haven area. So while it's not exactly this study, it's very, important to this work as well.
Thank you
I would
so
like
much.
to add in response to what you're asking about sustainability. I want to mention the moral imperative of doing this work. We live in these neighborhoods. I'll die probably in this neighborhood. And it has been astounding to do this work with the partners we have now. But even if they disappeared tomorrow, even if the funding dried up, this is work we have to do. We must do this. And that's what drives us.